Welcome all of you to the prestigious Dr. B.R. Ambedkar Open University. Today we are going to see how special senses, organs are there, and then endocrine system. The topic for today is skin, then I will be dealing with it in detail. Then we have completely about eye, then something about tongue, and then how it helps us. Then how temperature is being regulated in the body, and then we have physiology of lymphatic system. What is lymphatic system? And then immunological system also I am going to deal with it, and then we have glands, and then all different types of hormones that are produced in the body. What are the various organs of the body, the hormones that are present? So let us start with skin. The skin is the largest organ in the human body. It covers all the human body. It is very large. So why is it important? Because we have to know how it is divided. It is divided into two layers, epidermis and dermis, and the lower portion below dermis is called hypodermis. Epidermis itself contains 5 layers, and dermis, it contains 2 layers of the body. Then this, why it is epidermis is important? Because the uppermost layer of the human body, the skin, is keratinized. What is keratin? It gives the stratified squamous epithelium, which gives the hardness to the skin. It is more prominent in the hands and the soles. Then it contains keratin, as I told you. Then you have Langerhans cells, which are phagocytic cells, which are present in the epidermis, which gives immunity to the body. Then you have melanocytes. The skin has melanin, that is a pigment layer that gives a beautiful skin color like white or black, that is also very beautiful. Then you have the next layer is dermis, which is the inner layer. The inner layer contains many things like glands, hair follicles, and then few smooth muscles also. Then you have fibroblasts and blood vessels which supply the skin. Epidermis is without any blood vessels. Then you have nerve endings which apply when we have a sensation. It is because of that, because of the nerve endings. Then we have lymphatic system also drains the skin also. Then you have glands in the skin. What are the glands that are present in the skin? They are the sweat glands. Sweat glands are present all over the body. There are types of sweat glands. There are 2 types of sweat glands. One which is present all over the body, that is called sweat glands. They are mirocline glands. These mirocline glands, they are present on the surface, and it helps in temperature regulation. Then you have this, the next one is apocrine glands. These are special glands which are present in some areas of the body like breast, then axilla, then mons pubis, and anal region also there is this special apocrine glands which give special smell. Okay. Then you have sebaceous glands. Sebaceous glands are pear shaped glands. It releases sebum, and then if the sebum is obstructed, like for example you have acne, that is why there is acne formation, and this is a very common disorder found in girls and males also. Then you have skin appendages. What are these skin appendages? These are type of processes of skin only. These are hair. Hair is part of skin. This hair is divided into root, shaft, and follicle. Then you have nails, which are part of skin appendage, and this nail is also divided into root, body, and free margin. Then why is skin important? What are the functions? What do you think they are functions of the skin? It protects us from external temperature. It is for protection. Then there is temperature regulation will be there. If the body is hot, it will release the loss of body heat will be there from the skin, and temperature is maintained by the skin. It is a sense organ. If you have any difficulty, then the sense organ will act by the effector organ and then effector organ. Then the skin is essential for some vitamins like vitamin D. It is very essential. Sun exposure is essential so that the body makes vitamin D, and if there is no vitamin D, then you will result in rickets. Then the skin contributes to blood volume. How does it contributes to blood volume? If there is a lot of heat in summer, what will happen? There is loss of sweat that will help in regulation of blood volume, and then the skin, it will show dehydration. Signs of dehydration will be there from the skin itself. So, we can treat the patient. Then you have water and electrolyte balance will be maintained. Then how it protects us from UV rays? The sun, increasingly it will give us UV rays. So, it will protect us, the skin. Some people do not have melanin, that is why the skin is not protected. Then we have immunity. There are certain phagocytic cells that are present in the epidermis. So, it will help our body for protection from the invading organism. Then certain types of vaccines we can give inside the skin, like for example BCG vaccine. You have to give, it is given intradermal at the time of birth, newborn baby. Then for some times you have to, what is the function of the skin? It is for diagnosis of diseases. Like for example, if there is any allergy, you will do so much 50 types of different types of prick you will do on the skin, and then find out what type of allergy the patient has. Then sometimes we are allergic to some medicine also. So, you have to give test dose before giving the actual injection. So, there are so many functions of the skin. It is a sense organ. So, now coming to the next sense organ, that is eye. Eye, it is a beautiful organ of the sense organ of the body. It gives a shape to the individual. So, now imagine how the eye is there. It is divided into 3 layers. The outer layer is posteriorly called sclera, and then in front it is transparent. Posteriorly it is opaque. In the front, as I told you, it is transparent, and it allows the light to fall on the retina. Then there is a middle layer which contains blood vessels and also pigments, that is called choroid. This choroid, anteriorly it is divided into iris and then ciliary body, and then there are ciliary processes which hold the lens. So, the light can fall from the pupil through the lens on the retina. It will be focused on the retina, these lights. So, it will help in, this iris helps in like a camera, it will help in focusing of the light on the retina. The innermost part of the eye is the retina. So, this retina is very, very sensitive. So, if there is any detachment of retina, like for example, if you look at the sun, the rays of the sun they are very powerful. So, it will lead to breakdown of retina from its choroid. So, there will be detachment of retina. So, that will lead to blindness. Then coming to the interior of the eyeball. The interior of the eyeball, anteriorly it is divided into chambers. There are 2 chambers, anterior chamber and then posterior chamber. The anterior chamber is the part of the eye where it is between the cornea and the iris. Then posterior chamber is between the lens and the iris. So, why is it important? It is important because there can be infection of the cornea, infection of the iris, infection of the choroid, then infection of the sclera also can occur, and retina also. So, if there is infection of the iris, it is called iritis. Then if there is infection of the choroid, it is called choroiditis. So, this infection can spread to interior of the eye also. So, this anterior part of the eyeball, it is divided into, as I told you, anterior chamber and posterior chamber. In this area, there is aqueous humor that is present, that is a fluid filled cavity. There is fluid. Then posterior part of the eyeball, it contains vitreous humor. It is a gelatinous substance that is present since birth. This, now coming to the sclera, the outermost part of the eyeball, it is called sclera. That is the first layer. So, on this sclera, what happens? It provides protection to the inner contents of the eyeball, and then we have muscles of the eyeball also. So, these they are called as extraocular muscles, which help in regulation of the movement of the eyeball. And this sclera, the extraocular muscles, they get inserted there. They actually starts in the brain and they get inserted on the sclera. Then what happened? There is conjunctiva. There are two types of conjunctiva, that is called bulbar conjunctiva and palpable conjunctiva, which covers the eyelids. Then they have the next layer is choroid. Choroid is the inner aspect of sclera, and then there are blood vessels which provide nourishment to the eye. Then you have ciliary body, which is present in between the iris and the choroid, and the function is that it holds the lens. So, if there is any problem in the choroid, then the lens will fall, and this choroid is divided into choroid body and ciliary body, ciliary processes, which holds the lens. Then actually coming to the iris, which can be pigmented, it can be black color, it is green color or light color, grey colored eyes. That is what is the most important thing about iris is the color. It is thin, pigmented, circular, and it contracts. It has circular muscles and radial muscles which are present inside. It has a central aperture. When there is the light falls on the eyeball, then what happens? It contracts. It will regulate the flow of light on the eyeball. And then if there is any inflammation, it is called iritis, and also it is heavily supplied by nerves, and the main function is it will dilate when there is less light, and then it will constrict if there is more light, and that is called light reflex. Then this aqueous humor, which is present in the anterior portion of the eyeball, it will maintain shape, it will give shape to the eyeball, and then it is protein free clear fluid. This vitreous humor, which is present in the posterior portion of the eyeball, it is gelatinous, and then the lens and the cornea, they derive nourishment from it. The anterior and posterior chamber has aqueous humor. Then this chamber, because it is fluid filled, it has certain pressure. That is, if this pressure, if it is between 15 and 18 mm, it is normal. If it increases, it is called glaucoma, and this glaucoma will result in blindness. So, every time you have to get, patients should be getting checked up for the by tonometry. This is there, which sees the pressure of the eyeball. If it is more than 21 mm mercury, then it is glaucoma, and then you will have treatment for glaucoma also. Then coming to the lens, this lens, it is biconvex and it is transparent, and there is no nourishment for it. It is avascular. There are no blood vessels supplying it. So, what is the function of the lens? It is focus of light rays on the retina, and this lens, as we grow older and if we have certain diseases also, this lens will be aging, and then it will lose water content and it becomes tougher, and lens will lose its elasticity and it becomes opaque. So, this lens has to be replaced, it has to be removed, and then a new lens has to be put. This is called cataract. This usually occurs in the elderly. Also nowadays, even young people more than 40 years, or some drugs like steroids, if you give, then early development of cataract can occur. So, there are two types of cataract formation. Open angle glaucoma can result in the elderly people if you do not do, and if you do not remove the lens, and then they can be close angle glaucoma also. Regarding retina, retina is the most sensitive layer of the eyeball. It has photoreceptor cells, those are called as rods and cones, and this retina is, if you can imagine, it has 10 layers. So, it is very sensitive, and you have to protect the retina at all costs. When light rays will fall on the retina, it will become an image is formed. It will stimulate the photoreceptors and sends signals to the next order of neuron. There is a pathway for eye also. There are neurons which take the image that is developed, and then it will send to the optic center in the brain. Then if there is retinal detachment, it will cause blindness, and then if this melanin pigment which is present inside the retina and the choroid, which will, if there is albinism, the whole body is affected, also the retina is affected. So, they have to be very careful when light falls on the retina in albinism patients. There are certain areas in the eye which are very important, like for example, fovea centralis. Fovea centralis is that area where there are maximum number of rods and cones. So, it will, if that is affected by any disease, then the patient will develop blindness, that is called fovea centralis, and maximum acuity of vision will be there because of this area. Then there is area where there is devoid of photoreceptors, there are no rods and cones, that is the area where there is the central artery of the retina enters the eyeball, that is called optic disc. Then when you look at the eye, like for example in diabetes, that is called fundal examination. So, in diabetes you have to get your eyes checked up every 6 months, because there are effects on the eye also, that is called diabetic retinopathy. If the kidneys get affected, it is called diabetic nephropathy, but when an eye gets affected, it is called diabetic retinopathy. If for example, if there is blood pressure is increasing, it is called diabetic hypertensive retinopathy. The next sense organ is the tongue. It is very important. It helps in, we speak because of the tongue. It is actually, if you can understand, it contains 8 muscles of the body. It is a muscular organ. It helps in taste, chewing, swallowing, and also speech. So, it is essential for shaping sounds to speak. On the surface of the tongue, there are taste buds that will detect sweet, sour, salty, and bitter. And it is very important, if there is any lesion in the brain, it is supplied by hypoglossal nerve. If there is any lesion, the tongue will deviate to one side. That is why any lesion in the brain will affect the tongue also. It is actually, tongue is anchored to the floor by the lingual frenulum, and the root is attached to the hyoid bone in the neck. This tongue is very important because it has many organs supplying the tongue. It is divided into anterior 2/3 and posterior 1/3. This anterior 2/3, it is supplied by 2 nerves, lingual nerve which is sensory, and chorda and tympani nerve which gives taste. The taste buds are supplied by chorda tympani nerve. Then this posterior 1/3 of the tongue, it is supplied by glossopharyngeal nerve, and the actual muscles which are present in the tongue, it is supplied by the hypoglossal nerve, which is the nerve starting from the brain. Now coming to the next sense organ, that is regulation of body temperature, which is done by an organ in the body which is a endocrine gland, the part of the brain which is a thermostat of the body, that is hypothalamus. Now, what do you think the normal body temperature is? The normal body temperature is in between 36.6 and 37.2 degrees. There are 2 temperatures in the body actually, the shell temperature and core temperature. This shell temperature is the surface temperature of the body on the skin, that is 31 to 34 degrees centigrade, and this core temperature, it is actually the visceral temperature of the body. It is recorded by rectal temperature, it can be recorded in that way, and then it is about 37 degrees centigrade, and there is continuous regulation of body temperature accordingly. So, what are the factors you think are affecting the body temperature? It is time of the day. The time of the day, in the morning the temperature of the body is lowest, that is why you feel shivering in the morning. And then physical activity. If you have very less physical activity, there is no increased body temperature, but if you walk steadily and if you run long distances, then the temperature of the body increases, and then you have sweating. That is how the temperature of the body is regulated. Then age, the newborn, the temperature of the body is not regulated very well. That is why you have to be very careful in keeping the body warm of newborns, and also the elderly. This temperature regulation is very thin, very little in elderly people also, because of aging. And then there is another, the female, normal female, the temperature increases at ovulation about 0.5 degrees. that is about 14 days before the menstrual cycle occurs. Then there is something called basal temperature of the body, that is high basal. It is sympathetic, because of sympathetic tone of the body by the nerves, it maintains a basal temperature. The body size also matters. If there is less body size, then there will be, and also high protein, heat is generated more. What are the regulation? How is the regulation of the body is done? It depends on the environmental conditions and the type of clothing you wear. If you wear a clothing which allows the heat to transmit, like for example cotton, it helps in regulation of the body temperature. Then sleep. At sleep, when we are sleeping, the heat production is very less, and emotion, excitement, it increases the body temperature. Now coming to what are the principles of heat generation and transfer. The principal source of heat generation is skeletal muscle. How is it? What happens when the heat is generated in skeletal muscles? Heat flows from muscle to the blood. Then from there it is transferred to the core temperature, the surface temperature of the body. Then it will transfer to the skin. Then heat is lost. If heat is generated more from in the body, heat is lost. And if you want to decrease that loss, then it will retain the if there is any increased loss, it will be retaining it. There are basically two methods by which heat regulation is done. Behavioral thermoregulation, that requires conscious efforts by changing conditions of physical environment, like for example you have air coolers or air conditioners. You want to maintain temperature of the body by decreasing the environmental temperature, and then also includes heating or cooling of the space, and especially the clothing what you wear. Then the main is physiological thermoregulation. Physiological thermoregulation is done by receptors in the skin, which carries the afferent thermoregulatory receptors. By the nerves, it goes directly to the thermostat of the body, that is the hypothalamus. Then from the hypothalamus, there are efferent pathways which come and regulate the thermostatic temperature of the body. And what are the responses activated on exposure to cold? Promote heat gain by increasing shivering, increasing appetite, and increasing physical activity, and then the liberation of catecholamines, which are epinephrine, noradrenaline. Then appetite. Then what are the responses that decrease heat loss? Cutaneous vasoconstriction, that occurs in the skin, and changing in body's attitude, and then piloerection from the skin. So all this is done by a sense organ in the body or a part of the body in the brain, that is called thermostat, which is the hypothalamus. Then we come to the lymphatic system. Lymphatic system, it is a system in the body where there are tissues, organs, glands that work together to drain a fluid called lymph. It is a very important part of the body, and it has immune system which is regulating it. It keeps the body fluids in balance. What is the lymphatic system? What are the functions of lymphatic system? In this system, we have certain organs in the body which carries lymph, which will return excess interstitial fluid to the bloodstream. Then it will transport dietary fats absorbed from the intestine. The lymphatic system function is to return excess interstitial fluid to the bloodstream. It will also transport dietary fats absorbed from the intestines, and then producing and transporting lymphocytes for immune function, and filtering lymph through lymph nodes to remove pathogens, and then maintain homeostasis. What are the lymphatic organs? Lymphatic organs are bone marrow, which is present in the long bones. There is thymus, that is organ which is present retrosternally, and there are lymph nodes in various parts of the body. Then there are lymph vessels, spleen, tonsils, all these are lymphatic organs. What about the poor lymphatic drainage? If there is poor lymphatic drainage, there is edema present in various parts of the body, face or small blisters, discoloration of the skin, and increased infection will also occur because of this. Elephantiasis is where there is blockage of lymphatic system, which occurs due to filariasis. Now coming to immune system. What is immune system? Immune system is how we resist, our body resists for infections. It is a network of organs the WBCs which are present in the blood, proteins and chemicals that work together to protect from an invading organism. This invading organism can be bacteria, that can be virus, can be any parasite. So, the main part of the immune system are the WBC antibodies which are developed because of this. The body resists by generating antibodies, and there is complementary system which helps antibodies, and then the lymphatic system which carries lymph, spleen, bone marrow and thymus. This is all part of immune system. Now, coming to types of immunity. Types of immunity is natural immunity, which is their innate natural immunity that affects the a body or a baby also, fetus also has some immunity because the immunoglobulins are transferred, that is called natural immunity. Then there is adaptive immunity, which is specific and long lasting. This adaptive immunity is active and passive. Active, how do we do it? The immune system, it develops antibodies which are generated in the body and which is natural, that is active immunity, and or it can be artificial also by giving vaccines. This type of immunity is long lasting. Natural immunity will be short lasting. Then you have passive immunity. Passive immunity is because we give immunoglobulins from outside when there are less immunoglobulins in the body. Then there is the two types of immunity, T cell mediated immunity and B cell mediated immunity. T cell mediated immunity is because there is it is also called cell mediated immunity, and then B cell immunity is because of immunoglobulins that are generated by B cell plasma cells. Then coming to the hormone system. The hormone system is divided into, the glands are two types, endocrine glands and exocrine glands. Endocrine glands are ductless glands, they do not have any ducts, whereas exocrine glands, they have ducts. These ductless glands, they secrete chemical substances called hormones directly into the bloodstream, and then they reach the target organ, and this is long term effect, it will have long term effect. Example, thyroid gland, pancreas, pituitary, adrenal. Exocrine glands, they do not have any ducts. So, whatever they secrete, like for example, sweat glands, enzymes, mucus, sebum, they secrete onto the surface or internal organs, they are released into the internal organs, and they have very less activity, short term activity, and especially sweat glands, they help in regulation of body temperature, and also salivary glands, they secrete from time to time, and then liver also is an exocrine gland. Endocrine glands, for example, you have hypothalamus. Hypothalamus releasing hormones which have effects on various parts of the body. Like for example, you have CRH, cortisol releasing hormone. CRH will affect the pituitary, which releases ACTH, and ACTH will affect the adrenal gland and releases various steroid hormones. Then you have TRH. TRH is thyroid releasing hormone from the hypothalamus, it will affect the pituitary, then the pituitary will release thyroid stimulating hormone, and this TSH will affect the thyroid gland, and it will release various thyroid hormones which has effects on the whole body, maintaining basal metabolism, growth, and various effects on the body. All these hormones are very essential for the body. And then you have pancreas, which is a endocrine gland which releases insulin, and it will regulate the blood sugar levels. If there is no insulin at all, then it is called insulin dependent diabetes mellitus, and if it is partial release, then it will result in non insulin dependent diabetes mellitus. So, there are various hormones that are released from the body. Pituitary gland also releases follicle stimulating hormone which has effects on the ovary to produce follicles, which when released at the time of ovulation, it will combines with the sperm and ovum fertilization will occur. Then you have luteinizing hormone which will affect release of estrogens. Then there are so many hormones in the body which play a special effect on various systems of the body. If one or few hormones are not released, it will affect in many diseases. Like for example, if there is no thyroid hormone, it will result in hypothyroidism, and the patient will become fat, and then basal metabolic rate is decreased, and then as I told you, insulin, if it is not released, they will have blood sugar level will rise. Then ovaries also will not work properly if there is less estrogen and progesterone levels. So that's it for now. Thank you so much. We'll meet in the next session.